Okay, so greetings. We have a very international panel today, various time zones. So good afternoon, good morning, good evening. Indeed, we have panelists coming in today from South America, from Europe, from Africa, and from Asia. So we're almost completely covered globally in terms of continents. But just a welcome to the sixth panel and the sixth of our special webinar series on the impact of the pandemic on women and girls in developing countries. This series aims to engage researchers, policymakers, and practitioners on matters around women's empowerment and the impacts that the pandemic and its associated crisis has on women in the global south, with the hopes of trying to identify some pressing research priorities and some potential policy solutions. So the dual crisis that we're seeing today is exacerbating inequalities globally, and certainly all the signs are pointing to disproportionate impact on women and girls, as we've seen in our previous webinars. Social protection, of course, is increasingly important in order to mitigate some of these negative impacts on livelihoods and well-being of the world's most vulnerable, and yet it faces a number of new challenges. So on the one hand, we have this increased number of individuals who require social protection. On the other hand, there are at least two major impediments for the delivery of such programs. First is the global economy faces a historic downturn. Government revenues decline as fiscal spending rise, and funds tend to be redirected to COVID health care and research and development. So funding available for social protection, especially in the global south, is at risk. And so just yesterday, we saw reports of a 30% decline in humanitarian aid coming from top donors. So navigating the increased need with decreased resources will be a defining challenge moving forward. And second, sanitary measures required to minimize the spread of disease is making the logistics of program delivery immensely difficult, requiring creative solutions, often involving remote delivery of programs, which may or may not be as efficient as in-person delivery. So we were going to hear from four expert panelists today who will speak to us about some of the recent trends, practical solutions, on-the-ground experience, and the delivery of social protection programs during this pandemic. The Women's Empowerment and Development Lab at McGill University is immensely grateful for the support of Canada's International Development Research Centre through its Growth and Economic Opportunities for Women, GROW. So GROW is a 5-year action research program jointly funded by the Bill and Melinda Gates Foundation, the William and Flora Hewlett Foundation, and IDRC to find scalable solutions for advancing gender equality in the world of work. Working with partners in East Africa, the program focuses on 3 areas, although our series takes a global approach. But those 3 areas are addressing gender segregation in employment, reducing and redistributing unpaid care work, and unleashing women's collective agency. And so while we are meeting virtually, the series and the lab are hosted at McGill University, which is located on land that has long served as a site of meeting and exchange amongst Indigenous peoples, including the Haudenosaunee and Anishinaabe nations. McGill honors, recognizes, and respects these nations as the traditional stewards of the lands and waters on which we meet virtually today. So before introducing our panel, just a quick reminder of today's run of show. Each panelist is going to present for about 15 minutes. As members of the audience, you'll notice that there's a question and answer bubble at the bottom of your screen. Feel free to use that, and then we will then address those question and answer once the panelists have finished and we've moved on to that portion of today's panel. So I'd like to now introduce our first speaker. Our first speaker is Syed Hashemi. Hashemi has a long career in teaching, research, and managing programs for the poor. He taught economics at Jahangirnagar University in Bangladesh, directed an anti-poverty research program at Grameen Trust, and set up a development institute and chaired the Department of Economics and Social Sciences at Brack University. He spent 9 years with CGAP at the World Bank, focusing on financial inclusion of the poorest and ensuring a social performance bottom line in microfinance. He also designed and headed the successful multi-country program to develop new pathways for the poorest, especially women, to graduate out of extreme poverty through integrating social protection, livelihood activities, and financial services. Hashemi contributed to work on an expanded agenda of economic inclusion for the poorest and most vulnerable at the Partnership for Economic Inclusion until the end of 2019. Hashemi, the floor is yours.
Thank you, Sonia. Let me just share screen. All right. Okay, everyone. Greetings. It's evening here, so good night for those on our side of the world. But what I wanted to talk about as the first speaker is some basic issues around what is impacting or how are women getting impacted during this COVID virus, and what should a more holistic social protection look like for the future. We need to be able to use this experience to be able to learn how to deal with such emergencies in the future. So that's generally what I'll be covering. We'll start with the economic impacts on women during this time. Now, generally during any times of economic downturn, it is industries where men are heavily engaged in that get affected, such as construction and manufacturing. In this case, of course, those affected, but to a great extent, other industries where women predominate, the travel industry, hospitality, and childcare services, those have also been deeply affected. So women too, as workers in these sectors who normally would not get affected in normal downturns, got really badly affected, losing jobs and losing earning capacities. Also, another sector, especially for poorer women, is microbusinesses. A lot of women in sub-Saharan Africa who had microbusinesses lost their demand for their products and lost supply services. And so therefore they ended up really losing their businesses and losing those earning capacities. In the urban sphere, especially too in South Asia, domestic women workers have lost their jobs, or at least been laid off with reduced earnings in many, many, many cases. And in most urban cities and towns in South Asia, you have a huge army of these women workers who've been laid off or fired temporarily. So they've had to adjust and adapt. Also, women workers in ready-made garment industry. There are some industries where women are predominantly the workforce. And in this case, the ready-made garments industry in Bangladesh, for example, 4 million women were employed. And they all had to, factories closed down, they all had to leave. Many of them were fired, and a huge number of them did not receive adequate compensations. And remember, so the economic impacts multiply because of value chain effects. So just increases through different cyclical streams the negative impacts on women. Aside from the economic impacts, there have been quite a few non-economic impacts. One, pretty much all over the world, is the increased burden of care at home, especially with elderly people not being able to go out. I mean, even if they aren't ill or anything, the fact that they're home continuously, that puts a great burden on women. Shutdown of schools have meant they have to take care of children for 24 hours. I mean, they don't have that 8-hour or 6-hour reprieve they used to have with schools opening. The increased stress of staying at home, husbands and wives together, stresses of economic issues, not getting wages, have added to not just the mental side of it, but to domestic violence. And many reports point to that. There's also been an issue with restricted access to sexual and reproductive health. Because of the lockdowns, women haven't been able to go out and seek these services. And very few of government interventions providing transfer payments, providing food, have added on a certain package to help women with their reproductive health needs. In many cases, especially in urban areas, shutdowns, absence of the workforce in water and sanitation have led to decreased access to these. I talked about shutdown of schools. Also, women in many parts of the world are the majority, or at least disproportionately significant section of frontline workers related to the healthcare, for example, nursing and others. And so that's where women have suffered. In addition to that, especially when it comes to healthcare needs of women, the fragility of the healthcare systems. In Bangladesh, for example, which is true also, I know of urban areas in India, the healthcare system has pretty much gone under. And especially private sector, also government, doctors aren't coming in. I mean, some of them, of course, are risking their lives. A lot of the workers within these hospitals are coming in. And so there's been a real decrease in access to services and healthcare systems. Another thing that we have noticed is that while urban women are getting some support, well, along with their husbands and their families, rural women less so, and a lot of different populations, refugees and internally displaced people, are suffering. Ethnic and religious minorities, in many cases, are also suffering. People in remote communities, just because of the absence of transportation facilities, they are suffering. They're not getting the adequate services. And also within the household, demographically vulnerable people, especially the elderly and the children, there are very, very few instances where safety nets are especially targeting them. Safety net packages are for the household, for the family, and in that way they're benefiting. But there are specific needs of children and the elderly that isn't being served. Interestingly, though, this one part of Bangladesh, the hill tracts, Chittagong hill tracts, and its ethnic minorities that have faced systemic persecution over the years from the majority Bengalis. Amazingly enough, I guess it's because of foreign donations and donors and NGOs, they've been supported very strongly during this crisis. Now, let's get to coping with the pandemic. The first thing all over the world that governments have used, and even in some cases, community organizations, is food and cash transfers. But there, the issue has been the adequacy of that. However, are they receiving enough? The coverage, is everyone receiving it? And we talked about gaps in the previous slide. And especially for food, is that a nutritionally balanced set of food grains and food stuff that they're receiving, or is it primarily starch? And for how long? I mean, first round, April, May, there was quite a bit, but then that has started declining in many cases in many parts of the world. Now, savings and financial services, we find a lot of cases, or actually a majority of cases all over the world, where one of the crisis coping mechanism has been going to their savings and accessing financial services. But here too, if you have women in microfinance institutions, they have immediate access. But overall, when we're talking about the entire population, and here one of the things that is significant is when you're looking at it from the lenses of MFIs, from that side, a lot of people seem to be supported by microfinance institutions or even NGOs, like BRAC, for example. But when you're looking at it from the other side, looking at national level data and looking at national level household surveys, MFIs are providing, I would, in Bangladesh, where you have so many MFIs, serving less than 5% of the population with adequate, serving, and then the adequacy remains in question. So with women, in terms of the financial services, not savings as much, but that's been especially low. Now, because of the restrictions in mobility, technology, digital money has been one way of providing listing of people, providing access to services, providing transfers. But here too, women have been at a disadvantage unless they've gone through some training like this already. So it's harder for women to access a lot of the digital money. But though that's been decreasing quite a bit, but in Bangladesh and South Asia, but other parts of the world, that's different. We talked about sexual and reproductive health. That's been limited during these times, and not just reproductive health in terms of their needs, but also in terms of going to the hospital for delivery and postnatal care. The other thing in terms of coping with the pandemic has to do with stimulus packages, especially for recovery. But here, with the stimulus packages, it's unclear who's receiving it. For one, primarily it's going to be big businesses, much less so for micro businesses. And even there, with small and micro businesses, it doesn't seem to be that it's targeted specifically for women micro entrepreneurs. So the stimulus packages, which are essential for restarting economic activities, have been focused or will be focused, we assume, unless there's adequate steps to rectify that. It would be going to men. Now, as we look at this and we hope for the best, one of the things we need to start engaging in is discussions around the gaps in social protection, and then taking the necessary preparation. So something like this, and it doesn't have to be a pandemic, but other types of major insecurities or major disasters, whether it be conflict or natural disasters. How do we prepare for that? So there, what we need to do is rethink social protection as it exists. So better targeting for women and specifically in vulnerable and marginalized population. Expanding financial inclusion to make sure vulnerable women are included and they receive adequate access. Food and cash transfers, not only determining appropriate amounts and length, but also ensuring that sexual and reproductive health care needs are met, not through the service, not just through the service, but through ensuring a little package, including sanitary napkins and other things that women might need. Making sure that providing childcare facilities or vouchers for childcare, that's included as part of social protection. Universal social insurance. And while I recognize many countries will have budget constraints, countries like ours in Bangladesh, we need to do that starting with at least female-headed households, government-subsidized universal social insurance. Stimulus packages, we talked about that, starting with women and focusing on women-owned enterprises and also industries hiring women. The other thing that has been, in our understanding, has been critical in the abdication of responsibility of the private sector towards their employees. And while that varies from in different industries and different employers, what has been laid bare in Bangladesh is the plight of garment workers, the women garment workers, and how the owners have reneged on their commitment to provide for them. And finally, of course, to make all this successful, and when you hear of all the corruption that is going on and all the mismanagement, much more than corruption, there needs to be better governance in the social protection regime. I'll stop here. Thank you very much.
Great, thank you. Certainly, this has given us a lot to think about. So thank you for setting the stage. So our second speaker is Francesca Bastagli from ODI. Francesca is Director of Equity and Social Policy. She specializes in public policy research and advisory work on the design, implementation, and evaluation of social policy with a focus on social protection policies and their poverty, inequality, and employment outcomes. Her most recent research is on adapting social protection to the future of work, inequality, and fiscal policy, and the design and impact of cash transfers. Her country expertise is broad, having worked in countries in Latin America, Middle East and North Africa, West Africa, South and Southeast Asia, and Europe. She holds a PhD in social policy from the London School of Economics and a laureate in economics from Bocconi University. Francesca, the floor is yours.
Thank you very much, Sonia, and thank you also, Hashemi, for setting the scene. Let me try and share my screen. Okay. So just a minute. Okay. All right. So some of the points I'm going to make will overlap with Hashemi's points. I'll try to maybe emphasize a slightly different angle, but I am focusing on the implications for social protection of COVID and inequalities in the world of work, focusing on gender inequalities in the world of work. So what we've seen, I mean, so the crisis has brought social protection firmly on the policy agenda as a crisis policy response tool. We're seeing social protection making headlines in countries worldwide as governments adjust their social protection policies, introduce new ones in response to the crisis. The crisis, however, has also exposed gaps and contradictions in social protection policies, including important gender gaps in social protection that are linked from gender inequalities in the world of work. And that's what I'm going to try and focus on here. Part of the reason why I'm focusing on work-related inequalities and the implications for social protection is, of course, that some of the peculiarities of this crisis are specifically related to the impacts it's having, the differential impacts it's having between men and women in the world of work. So these social protection gaps, which I'll come back to in a minute, really arise from two sets of things, which we won't probably get the chance to look at in detail now. But one is the way in which social protection rules, as they're currently configured, interact with existing gender inequalities in the world of work. And secondly, and relatedly, because of the assumptions that still commonly underpin social protection policy design regarding the gender divisions of labor, where policy still either explicitly or less so directly and intentionally still makes assumptions about the distribution of work, particularly around the concentration of responsibility of care work among women. So the gender gaps we're seeing, and these gaps are not new, but what's interesting is that the COVID crisis is highlighting them, are gaps across the board, and we've heard Hashemi has already summarized many of these, but we're talking about gaps, social protection gender gaps with regards to participation and coverage of social protection schemes, but also the adequacy in the level and type of social protection provided. When it comes to participation and coverage, classic examples that are increasingly, as I say, being emphasized by the current crisis are that women are at a higher risk of exclusion from participation in particular schemes, and I'm thinking specifically of contributory social protection schemes, so employer and employee finance schemes. They also, though, there's also an adequacy issue where women, even when they do participate in social protection schemes, on average are in receipt of lower values of transfers. This is true if we look at, again, contributory type transfers, but also if you look at the value of social assistance transfers. And women are, commonly there's good coverage or better coverage among social assistance programs. The average value of social assistance transfers is lower than contributory transfers, like as in the form of, for instance, old age pensions. Furthermore, of course, another gap arises and is I think being emphasized now around the type of provision, and historically. Risks or life cycle events that are specific to women have received limited or even no social protection provision at all, and this doesn't mean that important progress hasn't been made in recent decades, and I'm thinking specifically of maternity and maternity rights and entitlements, but also other particular aspects that have been addressed through social protection reform. Still, there are important gaps there, and we'll come back to them in a minute. So what, a key question that we've been asking ourselves, and a colleague, Abigail Hunt, and I have just finalized a paper that was, we had started on pre-COVID. So in some sense, I mean, we will now be updating, but I think is relevant here is that we were looking at social protection and the future of work from a gender perspective, and thinking and documenting some of the persistent gender gaps in social protection and what reforms or initiatives have been introduced over the years in terms of social protection design and implementation to try and address these gaps. And I'm going to just quickly review them. There's a list, a table here that reviews. I'll just very briefly give you a recap, because some of these continue to be and possibly are even more directly relevant now to the context of the crisis more than ever. So we identify 5 areas in which social protection adjustments and reform have helped to address these existing social protection gaps over many years. One common classic area is in the concerns legislation and policy regulation. So here we discuss maternity provisions, so the adoption of maternity legislation and social protection provisions, mandating the extension of social insurance schemes to sectors of workers that are traditionally excluded, that are female dominated but traditionally excluded from social insurance, importantly domestic workers. Legislation that introduces or extends the portability of benefits that facilitates to address issues linked and risks of exclusions linked to interruptions in paid work or multiple employers, and indeed geographic mobility are one set of examples of where important policies or steps forward have been made. The second area, which is a very commonly cited one, concerns the expansion of social assistance. Here, as I'm sure many are familiar, over recent decades, the extension of social protection to women that were formerly predominantly excluded from existing contributory schemes has taken place through the expansion of social assistance, the adoption of social pensions, child family cash transfers, public works programs. These were taken forward in part as an effort to delink social protection eligibility from employment status. A third area, of course, is the adjustment of social insurance reforms, social insurance mechanisms. And some of these are adjustments that can help offset gender differences in paid and unpaid work and differences in work patterns into account. So there are options around subsidizing contributions and insurance premiums, introducing contribution credits for career breaks and care responsibilities that can help extend participation to women that follow interrupted career paths. And also to extend, again, social insurance to sectors that are traditionally have been excluded. A fourth important area concerns establishing or strengthening links between social protection and social services and infrastructure that matter specifically to women. And again, Hashemi has raised this point, but here we have seen in recent decades important efforts being made linking, for instance, cash transfers, but indeed also other social types of the transfers to the provision of childcare, training and skill development opportunities, linking cash transfer recipients to water subsidy programs and access to services that matter critically to women's time use and also women's opportunities for participation in paid work. And the final area that we identify and have been examining and will continue to examine looking forward in the COVID context, of course, is the phase of delivery and reforms or adjustments made to help tackle some of the implementation related barriers to women's access to social protection that arise from their patterns of work and the type of paid work they carry out. So here there are many examples around the simplification of administrative processes, the potential of harnessing some technological advances to address issues such as the invisibility of work, that women's work, that can act as a barrier to social protection participation. So with this in mind, this is a very broad overview of the kind of adjustments that have been made, and that even in the context of the crisis, I think we need to be mindful of as we think through crisis response, but also into the medium and long term, about the role and sustainability of social protection in supporting and tackling gender inequality. Just a quick word before we move back to the COVID crisis and how that matters, is just a sort of a caveat, which is that in all of this, we know that social protection, if appropriately designed, can be hugely effective in promoting women's empowerment, women's and girls' empowerment, including and addressing inequalities, including in the world of work. There's a growing body of evidence of this. And this is what we strive to do, to inform, better designed and implemented social protection. It's also true that I think, social protection can only take us that far. So as I said from the beginning, some of the gaps that we see persisting and that risk maybe even being exacerbated in the current crisis arise from some deeply rooted inequalities in the world of work and labor markets, which will require really a multi-pronged approach. Whatever we try to do with social protection will need to be accompanied by wider efforts around labor regulation and addressing social norms that continue to discriminate against women. So how does this all matter, and what way is it relevant to the current the COVID crisis? And by that I mean the health crisis, but also the social economic shock that is related to the pandemic. As I say, the crisis has highlighted social protection gaps. It has also highlighted some very interesting and in some sense potentially negative implications for gender inequalities in the world of work. On the one hand, I think an interesting trend, and there's been a lot of documentation and debate around this, is that the crisis has highlighted the essential value of services provided by health and care workers, domestic workers, so services that women commonly provide, that are commonly low paid or unpaid. So there's this recognition or growing acknowledgement of the essential value of services and work that up until recently was commonly labeled low-skilled work. A second key trend, of course, and Hashemi has pointed to this, is the rise in care work and care need for care, and the rise in the responsibility of this care work falling among individuals or households, both as a result of the health of health outcomes and worsening conditions for people's health, but also as a result of containment measures, so school closures of care centers. And here we've seen interesting, on the one hand, evidence of men taking on additional care work, but also importantly, the bulk of this care work being still carried primarily by women. And the third key overarching, headline that is coming out of this crisis in terms of impact on the world of work is how it's disproportionately affecting women workers. And this is a very, I think, increasingly clear, consistent evidence coming from countries across the globe that the sectors that are most negatively affected, as Hashemi has pointed out, are ones in which women are overrepresented. So if we think through, here I listed distribution of unpaid work, participation in paid work, type and conditions of paid work. These are some of the factors that along which there are already persistent, strong inequalities between men and women, and where COVID risks exacerbating them further. So here I think we need to be, particularly careful about, as we discuss social protection, acknowledging a risk that that there can be a setback, along these lines, and the implications that this has for social protection. I'm going to now point to three sort of main reflections that come out of the, very briefly summarized evidence around how COVID is affecting inequalities in the world of work. The first has to do, and so the key policy questions we're certainly looking at, and where there are also already emerging lessons or implications coming through. The first has to do with social protection framing and the valuation of work. So one of the reasons why we continue to see these gender gaps in social protection provision is the prevailing conceptualization of work in terms of paid work and market wages. And this crisis is, this is nothing new. So this has been a subject of discussion and monitoring and analysis for decades. But this crisis is highlighting the gendered implication of this approach, and highlighting the need to very carefully reconsider how we conceptualize work, how we value care, and how we can use social protection to help address these issues. And as I say, the framework that I shared previously in the paper that we're just publishing provides some very concrete examples of how social protection policies can be used precisely to help move forward the valuation and the redistribution of unpaid work. A second key point concerns addressing social protection gaps for affected workers. So we as we've said, the crisis has significantly impacted jobs and income security for workers, women workers. And many of these are workers in the informal economy. So the crisis has highlighted the need and urgency to set up adequate provision of social protection for informal workers who by definition are excluded from formal social protection mechanisms. And here too, we see risks in the context of this crisis, but also an opportunity, because I think it's been actually quite extraordinary the level of attention that is being paid to opportunities and options for extending social protection to this group of workers. And here again, there's quite a lot of concrete examples underway, but also initial analysis around how efforts to both expand direct income support to workers in the informal economy, but also to adjust employment or social insurance contributory schemes to extend and to extend these types of social protection to these groups of workers. They are being analyzed and happening. So and raise a number of questions, which maybe we can go to when we in the Q&A. And finally, the third key priority area, and around which more work needs to be done, has to do with linking social protection to services and infrastructure that matter to women. We've listed these already. I think, as I said, the crisis again, highlights the gaps, but also highlights and presents opportunities for us to be supporting and informing policy reform in this direction. Thank you.
Great, thank you, Francesca. I'm still taking down notes as you're finishing your presentation. So thanks for giving us that sort of overview of a lot of these issues that we need to think about, and especially when it comes to the world of work. Our third panelist is Munshi Suleiman, who's the Regional Research Lead for Africa at BRAC Institute of Governance and Development. Munshi did his PhD at the London School of Economics and worked as a postdoctoral fellow at the Economic Growth Center of Yale University. He has extensive experience in the design, implementation, and evaluation of policy interventions using both experimental and non-experimental methods. He has been engaged in research on evaluating youth and healthcare interventions, financial and livelihood services, food transfer, and entrepreneurship programs in several countries in South Asia and Africa. Munshi, the floor is yours.
Thank you, Sonia, and the previous presenters. I think I also have a bit of overlap in the content of my presentation, so I'll try to skip through some of those. And yeah, it's kind of natural, I guess. It's a global thing. We're sort of looking at the same situation. So it's the similarity is probably a sort of confirmation of the important issues. So in my presentation, I'm going to draw on a few of the research pieces that BIGD has been conducting under this Rapid Research Response Initiative to COVID-19. There has been a series of work trying to do sort of policy work and influence sort of some policy decisions, mostly in Bangladesh, but we have been doing some other work where BRAC is also working. So I'll come to those. So yeah, I'm going to sort of draw on these three specific pieces. One is a rapid food and income security assessment that we have been conducting in 10 countries where BRAC International is operating, 5 in Africa and 5 in Asia, outside Bangladesh. The second two and the second and the third pieces are specific to Bangladesh, and I'll sort of talk about those as I come to the relevant slides. So one thing just that I wanted to, a couple of things I wanted to pick from these rapid assessments that we have been doing. So as I said, it's in 10 countries. So we have been doing periodic assessments since early April. We have done 4 rounds of assessments so far, early April, mid-April, early June, and mid-July. And focusing mostly on food security. So this is just to show one particular indicator of how long they can sustain their food needs based on the sort of available means they have at home. So the numbers are average days for each respondent group, separated by male and female headed. The sort of interesting bits that I find is early on, sort of, especially in Africa, so the sort of late March, early April was the sort of early lockdowns in Uganda or Tanzania. Around those times, you can see there was not a big difference between male and female headed households. If anything, they seem to be a little bit better off in terms of food stored at home, taking that as a food security measure. But as time continued, things are getting worse faster for the female headed households. So that's kind of confirming the safety net needs that we have been talking about, especially for female-headed households. The second aspect that with the gender lens that gets duly highlighted is the domestic violence. So we've been trying to sort of assess that as well. So these are the 10 countries where we have done the assessments in at least 3 rounds. So, I mean, because of ethical issues, we didn't sort of hone into specifics of domestic violence, but we sort of asked about it in a roundabout way of if you know there are increases in community level violence, and it's kind of, yeah, it shows quite a big sort of local differences. So it's not universal the same way. In Uganda, South Sudan, we see it's much higher than the other contexts. But pretty much everywhere when we sort of ask the follow-up question, so what type of violence are you talking about? It's majority of the cases are domestic violence. So again, sort of confirming the narrative that these are the primary concerns that we need to sort of address while we address the sort of health issue of the life issue of COVID. Then I'm going to move on to the Bangladesh side of the study, which was a national level study. I think it was tried to sort of pull together contacts of over 12,000 respondents, and the interviews were done over phone, reaching almost 6,000 participants in rural areas and urban slums. And it was done in early April, and we see what we kind of expected. There was a massive drop in income across the board, both in urban and rural areas. But when it comes to the female headship, there are some sort of interesting differences. Early on in April, the drop in daily income wasn't hitting the urban female as much as the male. But as Dr. Hashmi said, things have been changing. So if we do another one now, the sense is we'll see a different scenario, similar to the trend that we have seen in the sort of country-wise trends I was presenting. But when it comes to the safety net, it's clear that female-headed households are more reliant on informal risk sharing or informal support network. Just wanted to highlight those couple of numbers where it's substantially higher than male-headed households. So this was again early on, but we know this is a sort of, it's not a sort of COVID shock. It's a shock of global proportion. So this informal support will sustain, will work only so far, and can sort of reduce the need for formal supports, mitigate the sort of pressure on formal supports only so far. The third piece is related to an important stimulus package that the government of Bangladesh started early on, so late March, because of the importance of garment sector, and there were sort of news you may have heard, that over $3 billion were cancelled, the employers were stuck with their producers, and the buyers wouldn't buy. So there's sort of whole set of corporate social responsibility in the international trade that is relevant there. But there was a package, I think it was within $500 million of support package for the export-oriented garment industries. So in this research, BIGD gender team tried to sort of understand how this package is being rolled out and how it's affecting or helping the female workers who are the primary workers in the garment sector in Bangladesh still, by talking to the trade union leaders. And they sort of highlighted that the whole series of challenges that all the women workers and even the men workers are facing. So, unpaid wage, psychological stress, financial suffering. So all of those kind of are there. It's probably not so unique to garment sector only. But when we try to understand their perspective of how well this package is helping the workers, which is the ultimate intention of the package, it basically shows the weakness of the systems getting magnified by COVID. So it's the challenges that are coming, it's nothing new. These are the challenges of governance, challenges of transparency, but it's just getting magnified. So who's getting the package, the supports, that's sort of almost entirely reliant on the discretion of the garments owners. So you take the loan and I'll lay you off. So that's kind of, the bargaining situation that a woman worker has, and these trade unions are also sort of very restricted on how much they can actually put pressure on. Then there were concerns of how, even if it's done well, how much can it support actually? So they gave some numbers, and that shows that it's not gonna cut or last very long. And then the issues of transparencies and how it's being implemented. So lack of oversight, monitoring mechanism. So the overall, I think it's not just on this particular package, it's also our stimulus package, but the general social safety net. The weakness of the governance, the pre-existing governance systems is just getting magnified. So I just wanted to focus a little bit, since we're talking about solutions, what should be the research priorities? And this is maybe a little bit of self-criticism of myself, because I've been shown a bunch of these assessments where we're looking at the severity of the situation, but we kind of know. I think it's time to act, but there is a big unknown. What do we do about it? there are research going on and sort of testing the solutions and sort of adjusting to these different contexts, but these are probably far fewer than what we need. So, we need to probably draw more on the evidence that we know we have from before COVID and see how much of it can apply in this new context. So a good example would be the whole set of behavioral research. They're trying to sort of come up with behavioral approaches that you can apply on how to promote safety during COVID. So integrating domestic violence programming with safety net, that's probably an area we need to sort of look more into. Counseling supports for parenting digitally, because not just brag, it's everywhere. There is a shift towards implementing programs, because of the changed context as much as possible with digital platforms. Maybe that's one of the few good things that COVID has brought, that life is becoming more digital. Then digital financial services and informal risk sharing. Just wanted to highlight this because on digital financial services, there has been a lot of research and sort of reading up lately, and it seems like one of the most important areas where digital financial services actually make a difference is strengthening this informal risk sharing. So be idiosyncratic shocks, or earthquake shocks in Rwanda. So there are a whole lot of evidence that it does help, but we don't know, how much it can help during such a massive pandemic situation. But we need to sort of look more into that. But the other aspect that we need to look at, and the evidence is not as much there in my reading at least, is does it help the men or women equally enough or not? And earlier presenters also sort of talked about the pre-existing differences that can sort of exacerbate the situation. So I just wanted to finish with a sort of quick look at if we want to look at this gender-based violence. So this is from evidence gap review on intimate partner violence. So what are the areas where we know we have evidence from? So the big areas of economic empowerment, income generation, we know that helps, but we're talking about a situation where economic opportunities are very limited. So all of these highlighted ones, like the counseling supports or community advocacy, these we need to think differently. Some of these we are trying to shift digitally over phone, radio, television, however way. But as much as we can integrate these with the safety net, that's probably going to address part of the problems. And the sort of bigger challenges that others identified on the service access, etc., those of course are also there. So I just wanted to sort of highlight one particular aspect of it. So let's stop there. Thank you.
Great, thank you so much. This has been very interesting, and seeing these statistics, I think are really very informative, and certainly pointing to some very interesting directions for new research. So thank you so much for sharing. Our fourth panelist is Tatiana Rincon, who is Vice President, Social and Livelihood Promotion at Fundación Capital. And she's a professional in finance and international relations of the Universidad Externado de Colombia, with a master's degree in international relations from Carleton University in Canada, and a graduate diploma in territorial management. She has experience in formulation and management of social protection programs. Currently, again, as Vice President of Social and Livelihood Promotion of Fundación Capital, and she has served as National Director of the program Local Economic Development and Trade in Colombia, Ministry of Commerce, Industry, and Tourism of Colombia, and I think that there's quite a few more, a lot of experience from many different places, both from the policy and the practitioner side. So Tatiana, the floor is yours.
Thank you, Sonia. Good morning, good afternoon, good evening. I was asked by the colleagues from the Web Lab series to share with you more practical solutions and ideas about how we have been facing COVID-19, especially with participants of social protection programs. I work for Fundación Capital, and at Fundación Capital we work with governments, especially like we have been working with 14 governments in Latin America, expanding their financial inclusion programs, including digital technology. And currently we are integrating a productive inclusion layer into social protection programs with a gender perspective. This is an important work that we are doing with the support from IDRC Canada. And when the crisis started, we were asked. We were already in the field. We were already working with women alongside governments. And our main question at that time is how we can support participants of these programs during the pandemic. We said, okay, we have to engage somehow in remote delivery of the programs, but how we can do it. And even though we are huge fans of technology. We use, for example, we program applications into tablets. We rotated tablets with participants. We try to find these remote delivery mechanisms, but also since we were rotating tablets, we were very, very concerned about rotating the virus. So we said we have to find solutions, and we have to find like immediate solutions, because the least we would like to do right now is to be in the middle of a social protection program with a government, and then leave people completely by themselves. So we said, okay, we have to prioritize the use of digital tools that we have, but we have to think how we can use it within the context of the pandemic. We also identified that people at the moment needed key information, and still they need key information, information that is not only helpful for them in order to take care of their own health, etc., but also like they wanted to know very practical things about how they can access key services that were being provided by governments. And also the response we should have should be different in each country based on the specific country context that we had. So first, we needed to provide information, official information about the pandemic, because as you know, like things change very much from week to week. So sometimes people is confused. They don't know if they are in quarantine or what they are allowed to do this week, or they cannot. Also, we saw that there was an impact in terms of physical and psychological health. Many program participants live in overcrowded houses, and they needed like practical advice about parenting guidelines, for example, since they had to take care of children at home, and also like tips and ideas for family coexistence, and things like that. Also, people were asking about how they could manage their finances and how they can enhance their financial health. And also, like, we were very, very concerned about like gender-based violence and how we could prevent violence and deal with the stress generated by the quarantine and the confinement. So what I'm going to share with you is basically three ideas of things that we are currently doing, and that was instead of this was more like a practical and an immediate solution. Like, we didn't run a huge study before doing this, but we are integrating a lot of research in terms of enhancing these solutions and see how they can really impact and hopefully enhance the way social protection systems are being delivered. So in many social protection programs, we have like program participants, they have one coach that supports them, or at least like one focal point that provides them with key information. And they already had like WhatsApp groups where they were like sending information about when they can meet, or they were like using these groups to provide and to have, to organize meetings and to arrange certain logistics for the program. So we use these WhatsApp groups in order to start delivering information, the information that I just mentioned. So for example, the picture that we have right now It's about advice, like we were telling the people, okay, this is Mrs. Sonia, and Mrs. Sonia is going to share with you how she's protecting herself and her family. So we sent like a picture of her, and that's like a very traditional way they have. And also like Madame Sonia, in this case, like she's washing her hands, and she's with alongside this text and the picture, we were sending a voice message by the woman. It was done in this case in Guarani, and she was explaining that she could wash their hands in her own language, but also like using certain products she can afford, because many of the government messages were like, okay, you can use soap and water, but also you can use alcohol. And sometimes they like the main campaigns were a little bit far from their possibilities. So like she is saying, for example, you can use black soap, which is a common soap they use. It's not necessarily commercial, but it's effective, and people really like, and they engage a lot in conversations within the WhatsApp groups, and it was a way of keeping contact. There is a large program in Paraguay that is called Tecopora, which is a cash transfer program, the largest one. And we introduced, for example, this story, and this is something that we are using. This is Madame Carmen. So she explains how she can leave the house, etc. But now we're integrating more video, because some people can read, but some others, they cannot read the messages. And for example, this is an illustration about...
you can't see your slides? Sorry, if you...
So I don't know if you saw the previous one, but basically like the basic idea is that we were using, I mean, I'm surprised, but the penetration of smartphones is quite important in our countries. Sometimes people don't have access to very basic things, but they can have access to smartphones. But we had to guarantee that the information and the things that we were delivering were not very... I mean, we're light, and they could go through, because sometimes they don't have like the best internet access and the best internet connection. But people are receiving like these messages with a lot of, they really like them, and they start like engaging with their coach, and the government feels, and they feel that the government is closer to the people, and that's very important for us, and especially it's much more important for the people and for the government. Another idea that we had in Colombia is that last year we were testing a virtual assistant, and this is based on WhatsApp. And the idea was to establish like a two-way communication, but in a most effective way. So I'm just going to show you a picture. So this is Connector, and we like. Well, this little bird is called Hector, and connector in Spanish also means, it's very close to English, it means connecting. And we were able to provide like services and information. Connector in somehow it's very similar to the WhatsApp groups, but it has a very important difference, is that because with the interactions, we are able to collect and track the data that is being produced, and we can use this data to learn. So the connector can learn and can deliver like better products, and can deliver like better information. So connector is something that we did in Colombia, and now we are integrating like more gender-oriented messages, and hopefully connector can, I mean, the big difference between the WhatsApp group and connector, at least for the user's point of view, is that connector at this moment can only provide like written information. But we are changing, and we are working a lot in terms of the technology. So very soon, connector will be able also to send, we will be able to send like gift messages, and we will be able to send information that people feel more closer, because it's more graphic, and it's also like voice information, because like in most cases, people have difficulties reading. And a third solution that we are currently working on comes from women themselves. Like we have been integrating savings groups into social protection programs. At the same time, we support like formal financial inclusion and access to bank accounts, etc. But we saw, like especially from a graduation viewpoint, that savings groups are very important also to increase women's social capital and to provide like a safe space where women can express, they can talk with each other and find solutions to specific challenges they may have. So during the pandemic, like women found that those savings were very useful for them. Like the first thing they did when the pandemic started is that they use the savings groups, and actually like they found ways. I mean, these pictures were taken by women themselves. Even they filmed small videos, so they share with other members when they opened the boxes and started getting their money. So it was like the first way they used to face the crisis. But something that we are currently doing right now is thinking with women how we could continue with savings groups, how we continue with these programs, and doing while we have in a remote way. So it's to see how we can continue complying with social distancing and government rules during the pandemic, and also because we think that even if a vaccine is well, now we have like a lot of encouraging news about the vaccine, but also we are very aware that before our communities have access to the vaccine, time will take. It's something that is not going to happen soon. So we are thinking about like how we could continue with a remote delivery of our programs, because for us what is important is to enhance the quality but also provide cost-effective solutions. And we don't think that I mean, that we think that we have to continue with this agenda, and also do like a lot of research in terms of the solutions that we are doing, so we can really know this is something that can be integrated for effectively for social programs in the future, and also for different countries. So having said that, I will stop here and thank you very much.
Great. Thank you so much for sharing how you've been doing this on the ground. I know that this issue about how to digitalize the delivery of these sorts of programs in general, and how we can use these sorts of tools to deal with the pandemic has come up in pretty much every one of our webinars. So I think it was very helpful to see how it can be done, or how they can be used to do this sort of program delivery. So I know that the question and answer has been quite active. I'm now going to let Leva Ruhani from WedLab take care of moderating the question and answer. So I will leave it to Leva to take it from here.
Thank you so much, Sonia. We've had such an interesting panel, such interesting insights, and we have some really great questions coming through. Just a reminder to everyone, all the attendees, feel free to submit your questions through the Q&A chat box. So I'll start with some general questions for the whole panel, and then we do have some specific questions to specific panelists. So the first two questions that I'll ask are, how can governments scale up investment in social protection programs to reduce the impact of COVID-19 crisis, maintain social cohesion, and reduce overall vulnerabilities? Should new digital technologies be considered? The second question I'll ask for the whole panel is, how can we ensure social protection programs such as cash-based assistance will get in the hands of women, especially since most work in the informal sector, who typically, under the no work, no pay scheme, do not receive Social Security assistance, have no leave benefits, and little savings? I'll open up to the panelists to answer those two questions, and then we'll go for a different round.
Are we waiting for me or?
Any of the panelists can go ahead.
Yeah, that's what I thought. And it's, so this was about government scaling up, right?
Yeah, scaling up and using new digital technologies to address social protection programs.
Right. Since everyone's so quiet, I'll start. The one thing in terms of scaling up investment in social protection, that's a broader issue that the governments of every country must reconcile with. And it is about what percentage of your GDP should be going into social protection. That's the first thing. What quantum of the government budget should this be comprised of? And that needs to be keeping going up. And that has to be people in these countries really fighting for that. So that's an internal thing. The second thing, though, once you have that, where should all this money be going to? What would be the critical areas that you would need to spend money in? And here, what we're saying is that it'd be directed more to women. Now, the ways to do it, especially if they're in informal work, is to create a database. A lot of countries are doing it as a social protection registry. So within the social protection registry, there are economic questions as well as segregated by sex. In fact, in Pakistan, they have this where the Benazir Income Support Program, for example, uses the social registry to provide safety net support to, used to be 8 million or something, I'm not too sure, but millions of people in there. So if you have some sort of social registry there, and it's fine-tuned to include people in the informal economy, and you have that occupational category, it's a simple matter of then being able to look at downturns, whether the downturn is due to a severe famine, whether it's due to bad crops or whatever, you could be targeting. So targeted safety net support through reducing leakages also opens up a lot of this, opens up a lot of support. So just leaving it at that, that's where it has to be going. And definitely women in the informal sector must be included, as should elderly people, specifically elderly women. What is happening in many parts of our type of world is that the traditional extended family, which has supported elderly people, that's breaking down. So you don't even have nuclear families. In many cases, it's sub-nuclear families. A woman by herself, kind of, an elderly woman. So it is about targeting broadly. That's what I'm referring to, and making sure you close leakages. Because even in Bangladesh, I was looking at raw data in one of the studies that I'm sure Munshi either is or will be involved in. You see a lot of mistargeting. People above the poverty line are getting that support, even though many below the poverty line and below the extreme poverty line are being left out. So that's broadly what I would say. And here the digital technology becomes important because that's exactly what they're doing in Pakistan, using that to make transfer payments, to identify and to have the social. So social registry becomes the first thing. I'll just stop there.
Yeah, if I may add, I believe at least in Latin America, like social protection is being valued by governments as a channel for emergency assistance. Like the very first things government did is to add additional payments to the regular payments of cash transfer programs. And even like universal rent is being discussed, something that was like completely impossible like 6 months ago. However, like the main question is how we are going to fund these programs in the long term, because like the economy is going down. So even taxes are not being collected the same way they were before, etc. So even though there is a lot of value in general of social protection as a very good channel to reach millions of people, like the question many people are asking right now is how we are going to fund these programs, especially in the long term. Also related to other questions about the use of technology versus, for example, the role of traditional media like radio, TV, newspapers, is to me, like the big difference is like you can have like general advice through radio, through TV, etc. But the idea here is to be able to give personal advice to each person that is in a that is part of the social protection programs. So in this way, we are trying to integrate this coaching approach that BRAC developed with the graduation programs to deliver like very specific advice for people. So like I was talking with someone like some days ago, and I was telling, look, I love to follow, for example, one YouTube channel about medical advice from a very good doctor. But I said, this is very good. I get a lot of information, but it's very different when I can get face-to-face, or at least when I can have a Zoom meeting with my doctor, because then I will get advice about my specific concerns. So this is the idea of how we can integrate like a more personal approach that could be more effective and closer to the people than like general messaging and like general advice.
Thank you. I'm going to ask two targeted questions. So one question we have for Francesca is from Hassan from Pakistan. He asked, in developing countries for working women, the ratio of social protection from employers is very low, and it is only in cash terms. At the same time, government is also giving relief to families on the basis of one family member in terms of cash and food items as well. Charity and donations also have very effective contributions to deserving families, but in all cases, people consume provided cash to other unnecessary things, and in some cases, they resell food items in market. I think we need mobilization and sensitization in this regard. What can be the best social protection approach in urban and rural areas where we have above-mentioned issues in developing countries? And I'll ask two questions that are targeted for Tatiana. Tatiana, why did you prefer Connector to WhatsApp in Colombia? Any special features for engagement with the women? As well as, in regard to the savings groups for women, how did you ensure male involvement to ensure that the resources saved by women did not end up in the hands of men? In short, how did you deal with the insecurities from men to empower women? I'll open the floor.
Thank you for the questions. If I may, I'll come back to the specific question on how cash transfers are spent in a minute, but just on sort of wider picture issues on scaling up social protection in crises like this one's, and also options to target or reach women. I think one of the key lessons that emerged from previous covariate shocks, so large-scale shocks that affect large numbers of people at the same time, is pretty simple. I mean, is that the most effective response is given if you have a social protection system in place, right? So of course, the moment the shock hits, the kind of challenges that the governments or a variety of actors and existing programs face in delivering in quote unquote normal times or non-crisis times are amplified, and we saw this also in Munchi's presentation very, very clearly. So the key issue, and I think also if we look back to the lessons learned from the 97 crisis, the 2008 crisis, where already a lot had been said and a lot of plans were made around establishing and institutionalizing social protection systems in order to be better prepared for future shocks and future crises. These lessons still hold, and I hope we keep them in mind, not just now that we're in the context of a shock and that we're, many governments essentially scrambling to try and set up mechanisms and respond to these very, very dramatic increases in need, but that we bear this in mind as we move into sort of in the medium to long term, including in the beyond COVID stage, if we ever sort of when we get there. And not only do we need to have systems in place, and that includes all the elements and components of a system that facilitate all the direct management and delivery phases of different social protection components, But the other lesson that did come across quite firmly is that mechanisms and or let's say schemes that are simpler, administratively simpler, and have high coverage tend to be easier to scale up when you need a quick, urgent, timely scale up to a high number of people. And so we heard about social registries. Yes, they can be hugely helpful if they gather information for large, for either the entire population or large population groups. When you have social registries that very narrowly collect information on only narrowly defined vulnerable population groups, they might have limited use. With regards to transfers, social assistance transfers, the more they are universalistic in inspiration and simple to administer, the more quickly you can scale them up. So I think, we actually know a lot about how particular design features and components of a particular program and wider system can enable timely, effective response. This doesn't take away from the financing question, resources question, which I think is a topic for a whole other webinar. But there are options for raising revenue and resources for this sorts of response. On targeting, just very quickly, and reaching women, I think so. It really it comes back to what are some of the barriers. Why are we seeing that some women still, and as I said, this crisis is revealing considerable and significant gaps, gender gaps in social protection. Why are we still seeing these? What are the barriers? And there's a whole host of barriers. And some of them are linked to technicalities of, around targeting and how you define, those sorts of, sort of implementation related issues, but there are wider political issues, which partly I think, I tried to address in the presentation. And there are very concrete, again, design implementation options that can be adopted to try and tackle these barriers, including the utilization of technology, where yes, in principle, if you use it appropriately, because it can also be misused, but where it's used appropriately with some clear principles, of inclusiveness, of privacy, and so on. Of course, technology can be hugely powerful in, for instance, making visible work that is still in many contexts invisible, and so on. So just quickly on the point of cash transfers, I think the question was around options, a concern about how cash transfers are spent or social assistance transfers are spent, and opportunities for sort of sensitization around, I think that, if I get that correctly. I'm a little surprised to hear this. Certainly, I haven't seen much evidence of cash being quote unquote misspent. I suppose you could, it will really depend on how you define that and from what perspective. I also noticed the utilization of the term deserving and not deserving households, and that too, I would need to understand what basis a household is deserving or not. Generally, I think when it comes to concerns about supporting households or individuals and population groups that have been adversely affected by a crisis like this one, the big focus and primary concern is to provide support to people. That has to be, frankly, where our energies go and where our resources go. And then the questions around monitoring how money is spent, questions of how do we, encourage or even, set, there are conditionalities on how transfers are spent there. I think there are big questions around, even from a purely sort of ethical perspective, is that the right thing to do? But even in practical and administrative terms, particularly where we're talking about reaching, people that really need support, is that really the focus? And in my mind, the answer is actually no. The main focus is to make sure we get resources and services to people in need, and to allow also, frankly, some degree of freedom for individuals and communities to decide what their priorities are.
Well, the question about the big difference or why I prefer the virtual assistant, which is connector instead of the WhatsApp groups, is because with the virtual assistant, I'm able to get data. And with data, those are like the baby steps towards artificial intelligence. And in this way, we can deliver more cost-effective solutions to people in the future. Like for us, like overall, the development industry, it has been the same over decades. And technology has evolved very, very quickly, but we are not using a lot of technology in development overall. So if we can start thinking about like the future and how we can deliver these programs in a cost-effective way, because even if we love coaches and this in-person touch, when we are delivering social protection programs, we rely a lot on the quality of the specific field worker that is there. We have amazing people. We have also others that are very difficult to follow, to really learn about their work. So the idea is to enhance the ability and to enhance the opportunities to reach more people in a more cost-efficient way, especially because if we want to keep social protection programs, we need to find solutions for cost reduction, as well as increasing the number of people who are receiving these programs. And I didn't get very well the second question, but from what I can see from the field is that I don't know, maybe it's the conditions that are at least in Latin America, where most cash transfer programs are conditioned, or maybe it's the secrecy of financial inclusion, but we don't see men asking women for the money they were delivered. Because first, they don't know when the money arrived into their bank accounts or into their e-wallets. And second, they know it has a specific purpose, and if this purpose is not met, people have the risk of being out of the program. So they are very careful in terms of on the way they spend the money. Also, and this is very important because it's part of the new perspective that we are trying to add to the program, is how we can integrate men, that they feel that they are part of the program, that they can contribute instead of creating a divide. We try to see how we can engage men and women and all the family and all the members in the household to identify one common goal and work towards it. So we are, that's why it has been so important about providing parenting guidelines, about family coexistence tips and things like that, because we want to strengthen the families and hopefully be able to promote dialogue within the households and try to change social norms, change the community and the views, and go beyond an individual empowerment of women, but see how we can contribute to a broader sense of gender in that regard.
Thank you very much. I'm really sad that we've reached the end of our webinar. The discussion has been incredibly rich, and I know that there's still a large number of questions from the audience. We'll try to put these together and share them with the panelists. But I certainly wish that we had actually a full day to address these issues, and I think this is just getting the conversation started. So again, I'd like to thank all of our panelists, and I know that we've lost one along the way, I think, due to an internet connection, but I want to thank you all so much for taking your time. Yes.
Could I quickly respond to the question you had? Because
yes.
That's just very quickly.
Sure.
And tied in with what Francesca was saying. Sonia's question had to do with working under limited budgets and how do we pay for that and what's going on. In many countries, including even in Bangladesh, there's a long-standing social contract between no matter who the government is and people that we will not get to a stage where we're having famines or people dying in large numbers. So governments will try whatever is best, and however the way they can do it. And that's where what Francesca had raised, this issue, this debate on universal versus targeted support. And that's a long-standing issue. We'll be talking a lot more about that. And basically, I stand on a different side where I look at, given the resource constraint, great supporter of very well-targeted support. And that's what most governments, I think, will end up doing. Thank you.
Thank you very much for asking that. Oh, we really need to, I think we're going to need to do a follow-up conversation on this. So, anyways, so no, thank you very much. I think we do need to end here. I think just to let people go to their next webinars, as I know that we're all very busy with these days. Just a quick note, Leva, I do believe we already have our next one confirmed. Tentatively is going to be focusing in particular on the context of COVID and women in refugee settings. So that is, I believe, August 4th, but please this is still to be confirmed, but please keep in touch with us either through our email, our website, or through Twitter. And on our website, you will see already the recordings from many of our previous webinars, as well as some summaries. And this one will as well be available on this website, just we need a few days for processing and all of that. So with that, again, thank you so much for a wonderful conversation. And I think a lot of us agree that this has been a very timely and very important conversation to have. So many thanks to everyone, and especially for those of you in the audience. We're seeing your questions, so we'll try to address them in one way or another through the summary. Thank you.
Bye-bye. Thank you.
Bye-bye,
Thank
everyone.
you. Bye.
Thank you so much.
Bye.